Hello, my name's Blair Sari. I'm the Clinical Support Specialist at Planer. Last week we hosted a webinar regarding the use of an oil overlay in embryo culture, particularly the new products on the market, the Kitazato Light and also the Kitazato Heavy Oil. Now, heavy oils have received a lot of attention lately, and there's certain benefits to using a heavy oil in a embryo culture system. So I was joined by Dr. Fernando Bronet, the director of the IVF and PGD laboratories at IVI in Madrid, as well as our UK sales executive Verity Ball and a senior embryologist from Kitazato DBMed, Gisela Maggiotto, who moderated the Q&A session at the end of the webinar. So don't forget, we are running a promotion available to the UK attendees that we have free samples of Kitazato Light and Heavy Oil to give to clinics who wish to try the products. So please get in contact with us if you would like to try the Kitazato Hypure oils. You may as well. They are complimentary samples. So the presentations are from both myself and Dr. Fernando Bronet. So I do hope you enjoy them, and we'll also discuss a bit more at the end of the presentations that goes over what was discussed in the Q&A during the webinar. Thanks.
Okay, so I'll just start things off with a brief presentation about why having an oil overlay is important in an embryo culture system, as well as introducing you to the Kitazato Hypure heavy and light oils, explain a bit about why there's been a lot of discussion around the use of heavy or more dense and viscous oils lately, and when it may be preferable to use a heavy oil as an overlay. So why oil? I'm sure as the esteemed embryologists you all are, you're aware of why we use an oil overlay in an embryo culture system. So they act as a barrier to contamination to stop contaminants entering the culture media. Of course, they minimize any fluctuation in temperature and pH of the media, especially when the dish is out of the incubator. And one that's received a lot of attention lately is the fact that an oil overlay minimizes the evaporation of culture media and prevents an increase in osmolality. So there has been evidence to show that an osmolality of greater than 300 milliosmoles per kilo does create a hypertonic environment, which leads to cell shrinkage and additional stress on those cells. So basically we use a culture oil to maintain a stable culture conditions and ensure that those culture conditions are optimal for embryo growth throughout the duration of culture. So there's been a few recent articles looking at the effect of oil overlay on osmolality in particular, and also looking at the various types of incubation, humidified versus dry. In this Yumoto paper in particular, it actually does include the Kitazato heavy oil as one of the oils that they compare. So what are some considerations that we have to take into account when choosing an oil for embryo culture? So we have to determine whether we're growing embryos in a humidified or a dry environment. A lot of the time-lapse incubators are actually not humidified, in which case you can see a higher rate of evaporation in the culture media. Whereas if you're growing embryos in a humidified environment, that rate of evaporation will be lower. So you may be able to get away with a lighter oil and a thinner oil overlay in a humidified environment as opposed to a dry environment. The volume of media and the volume of the oil overlay also important as well. If you have a large volume of media, for example, a well of media, there's going to be a lot less evaporation than if you have, for example, a microdrop. Because of course in the microdrop the surface area to volume ratio is much larger. Also the volume of oil overlay is important as well. A thicker oil overlay can prevent evaporation more effectively than a thinner oil overlay as well. The type and the quality of oil. So as we mentioned earlier, we've got heavy and light oil. The heavier oils tend to prevent evaporation more effectively over extended culture in non-humidified environments, and we'll talk about that a little bit later with the heavier oils. The quality of oil as well, so the water content of the oil, which sounds strange, but the water content of the oil can actually play a part in how quickly evaporation occurs. Also, we want the oil to go through rigorous quality testing, so it's free from bacterial endotoxins and the like that can actually enter the culture media through the oil and inhibit the development of the embryos. The environment, air quality, of course, very important. The humidity and general humidity of the lab. Obviously, these oils can become a sink, if you like, for contaminants and VOCs. Ideally, we want to keep those out of the culture media, of course. So the cleaner and more pure the air is in the environment, the less chance that these oils have of becoming saturated with contaminants. The media type, and are you refreshing the media on day 3? So some of the medias, especially those that are intended for extended culture, actually have a lower initial osmolality, and that way there's more margin for increase over the extended culture period before it reaches that sort of 300 magic number that's going to affect the embryo development. If you're refreshing the media on day 3, of course that's going to be new media. It's not in that extended culture for that entire period, but of course you do have to disrupt the embryos and the culture media in order to do that. So heavy versus light, the question that everyone's interested in lately, so it seems. So some advantages of using a heavier oil. You have greater stability. So for example, if you're having a dish with microdrops inside and you have to move around with that dish, with a heavier, more viscous oil, those drops are going to have a bit more stability. Over an extended culture, you're also going to see less evaporation, and some of the papers that I have showed earlier display that. But generally, because the process of making heavy oil is more intensive, it's probably going to be a bit more expensive as opposed to your light oil. So light, of course, you get faster equilibration, so it reaches its equilibrated state in the incubator quicker than it would with heavy oil. It's easier to handle in terms of pipetting, and it's generally cheaper, which of course generally seems to impress people as well. So a little bit about the Kitazato products. So these are new to the market, the Hypure Heavy and the Hypure Light Oil. So they are long chain paraffin oils, which means they're stable, they're less reactive than mineral oils, for example. They don't peroxidize and undergo peroxidation as easy as shorter unsaturated hydrocarbon chains might. Can store it at room temperature, which is actually quite a benefit. You don't need to take up room in your refrigerator. You can store it quite happily at room temperature for the duration of its shelf life. And of course, they're double MEA tested and pre-washed to remove any toxins, and certainly the testing is robust. And the level of endotoxin is actually extremely low. It's the lowest on the market, the threshold for the endotoxin level in the oil. Also, once you've opened it, you can also just keep storing it at room temperature for up to 28 days after opening. And so that, again, less room in the fridge, and it's quite happy being stored at room temperature for the shelf life. Unopened, of course, we have a shelf life of 18 months. So that's about it from me. Thank you very much for your attention.
Hello, good afternoon from everybody. First of all, I would like to thanks to Planner and also to Kitazato for giving me the opportunity to share experience with other experts like you. So it's always a pleasure for me to have this opportunity. Well, today I'm going to talk about the Hypure oil. So let me show you my experience. First thing that I have to say is that I have no conflict of interest. I'm not a planner or Kitazato employee. I'm just an embryologist like most of you and just work in an IVF clinic. My aim is just to find the best way of working, and I would like to show you which my way. The first question that I usually ask me when someone invites me to give a presentation is, why am I talking about one issue? In this time, we have to talk about oil. And the question is, why am I talking about oil? Let me show you one thing. If we look for some papers in the bibliography, we can find, for example, that one that comes from, we can see here from Human Reproduction, and it's quite new because it is from May of this year. In this paper, we can see again, this is a randomized control trial, and we can see some points, some parameters that are affecting the culture condition. One of these is the oils. We can see here on your right, we can see depending on the viscosity or the density, there is an impact on the culture condition. So it's saying that there is an important point about the oil in the culture conditions. So maybe we should talk about this. Second question that I usually ask me again is, why am I talking about this issue? And I mean, why me, Fernando Bronet, is talking about that? Because I'm not the scientific advisor of any company. So I'm just, as I told you, I'm an embryologist of one IVF center. So for me, this is very important because I don't have the aim of give you and send you any message about the benefits of one product. No, I'm just want to show you what's my way of working. So the question is, why I'm talking about that? Well, let me show you, give you some information. So I've been working with this oil from 2019, so it's more than 1 year, and you can think that this is not enough time, but let me show you more information about my clinic. Well, I've worked in IBI Madrid, so this is a huge center where there are too many staff working, which is something complicated sometimes for us. we have a daily workload of IVF cycles that are variable. So we range from 15 to 30 and sometimes more than 30 pickups per day, which is enormous. We perform more than 6,000 fresh cycles plus frozen embryo transfer cycles, which are more than 2,500 cycles. So all of this means that we are working with a huge volume of patients, with a huge volume of dishes. So just to have in account, the volume of oil that we use per day is between 1.5 and 2 liters per day. It means more than 200 or 300 dishes per day, which is more or less like between 3 and 4 barrels of oil per day. You can imagine this is a very huge volume of oil that we have to use per day, so we should look for the best way of working. Well, let me try to send you an idea of how we work in this clinic. So we are 20 embryologists plus 16 technicians plus 3 secretaries. Okay, we are different units depending on the type of the work. So here we have like an IVF lab, a neck donor program. We also have another different lab which is focused on vitrification, and we also have a different lab that is focused on pre-implantation genetic testing. Okay. Well, let me show you different equipment that we have. So in this lab we have 2 embryoscopes, 6 incubators from ESCO company, 1 Gary from Merck company. We also have 10 incubators from Aztec company, and we also have 40 incubators from Cook, the Ming one. So take into account that each incubator has different conditions. So we have incubators with 100% of CO2, like some of them. We have incubators with nitrogen. So also we have some incubators like Ming where we need a pre-mixed gas, or you need an external mixed gas. So we have a lot of different incubators with different conditions, so it needs different conditions. So we have to focus and find how to work with oil in all of these incubators. So for example, focus on humidity. So we have some incubators like those one, so the Gary one, Mings, that are incubators that are using water, so they have humidity. We also have other incubators like those ones, Embryoscope, Aztec, ESCO, that they are not working with humidity. So if we are working with the same dishes, we are working with the same oil, we should look for the way that could be the same for all the incubators, that allow us to work at the same way. So at the end, we should manage a lot of different conditions. For example, we have many different incubators. Some of these are with or without humidity. Since we have different kind of incubators, we also have different kind of dishes. So for example, this one is for embryoscope. This one is from Gary incubator. Those one are for embryo transfer. Those one are for pickups or for culture conditions. So we have many different kind of dishes. So we need to focus on each different dish in order to have the best and the optimal type of oil and the volume of oil. So we also have different kind of culture conditions like sequential media or only one-step media. So if we go for one-step media, the volume and the way of working with oil could be different than if we are working with sequential media. So at the end, taking into account all of these different situations, you sometimes need to know how to do it. And to be honest, sometimes it drives you crazy. Okay, so sometimes you feel a little bit crazy because you don't know how to manage all of these situations. So the point of this presentation is to look for the best way of working. So we should find the best way of working, and this way shouldn't be complicated. So we need to do it easy. Well, if we just take into account the quality management, so there are like four different areas where we can focus on. One of these is the staff, the other one is equipment, the other one is culture conditions, and there are other like quality controls. Well, we are gonna focus on culture conditions. Well, if we focus on culture conditions, we have to understand that there are two important points. One of these is that the culture should be embryo tested. However, this is not on us. It should be tested by the company. So we don't need to do anything about this issue. But the second point, control culture condition, is where we should focus on. Well, a quality management system includes the establishment of quality objectives and the process to achieve these objectives. So one of these is we can focus here in the laboratory. Okay, so inside the IVF lab, different aspects must be considered, mainly human resources. Okay, this is not the point of this presentation. Equipment, and which is more important for us, is the culture system. If you see and look, have a look on the slide, you can see here one of the culture system where we have to focus on is the oil. So that's the reason why today we are talking about oil. Why oil is very important for the culture conditions? Because it can affect the osmolality of the media. Okay, so what kind of factors can be affect the evaporation? Well, the media drop volume. The media drop volume, the work surface temperature, and the preparation time. So most of us, I think all of us, are working with culture conditions with microdroplets under mineral oil. So the oil is doing a barrier to toxic agents, and also the oil can minimize the pH change. So we are using oil in order to keep the culture conditions. If we come back to the previous paper that I've shown you, we can see that there is an impact of the oil in the osmolality. So we can see here that depending on the viscosity or the density, you can see that the kinetic is not the same, but at the end, the idea is more or less the same. The higher viscosity or density, the lower change in osmolarity. Okay. So if we focus on this paper, we can see that there is a change in the osmolarity depending on the microdot volume, but also in the height of of oil. Okay, so we can see here better that this is very important. Okay, this this distance from the drop to the air and the volume of the drop. So these things are very important in order to keep all these conditions stable. As I say, I'm not the scientific advisor of any other companies, so I'm just an embryologist, and the only advice that I can say you is that if we are working with oil, the higher volume of oil, the best results. So it is true that it is not sometimes not necessary to have a higher volume. So there is a cutoff where if you add more oil, you are not going to find more benefits, but it's not worse. But if you add a lower volume of oil, probably you're gonna have worse results. Okay, so just one thing that I can have to say is that in terms of oil, as much as you can. Well, sometimes this is not easy and it's very hard, so that's the reason why I'm going, or at least I'm trying to give you some tricks. The first question could be, how much oil should I add to the dishes? So this is depending on the dish that you are going to use. But in my case, so when I'm using petri dish, the little one, we are using 5 milliliters. If we use the other kind of petri dish, we are using up to 15. So probably you are thinking that this is too much. And you're right, because it could be a problem. There is an increase in the sealant risk, and it's true. When we have the lip, it's very sealed with the disease, and sometimes it's difficult, and it's a risk of when you are opening the lid. So, what can I tell you? How can we do that? I can give you how we are working. So we are not using lids in this disease, so it allows us to add more oil. So we don't have this risk of sealing the lid with the disease. Okay, but it is also a new problem. Why? Particularly in our case, we have a big lab, so sometimes you have to work long distance from, for example, from here to here. So since you are working without any kind of leads, sometimes the oil can fall out. Okay, so how can we work with this? Here comes my second advice. We are using bigger dishes just in order to transport the culture dishes. Okay, so by doing that, we are more sure and we can transport a lot of dishes in one way. Okay. So, second point, very important point, is the time. How much time is enough for oil equilibration? So, it's depending on the kind of dishes that you are preparing. So, at least in our case, when we are doing the setup for culture dishes, we left this in overnight, okay, all the night with pre-equilibration conditions. But if we are wanting to prepare ICSI dishes or ICSIs for denudation, we left this at least 4 hours. So we usually do the setup for this kind of disease at the beginning of the day. Okay. The next question is, for how long can we keep this disease? For 2 or 3 days. In our case, we don't want to spend more time than 3 days. So we usually prepare, for example, ICSI or denudation disease at the beginning of the day, but usually we have more disease than the ones that we need. So we left those diseases for the next day. And in the next day, those diseases that come from the day before are the ones that we are going to use for the first time. Okay, so for example, if we are going to start making ICSI at 11, half past 11 or something like that, we can use the disease that we have in the incubator that come from the day before. Why? Because if we start preparing disease, for example, at 8, between 8 and 9 a.m., we don't have 4 hours in the incubators the disease. So usually we start with the disease of the previous day. Okay. Well, another advice. We have been using heavy oil for a long time. That's the reason why we started with this kind of oil just in 2019 and not before that date. Because Kitazato had light oil previously, but we always use heavy oil. So if you don't mind what kind of oil you want to use, so I mean, so you don't mind to use heavy or light. My advice is just, at least in Spain, the lead is more friendly, the one that comes from oil. This one we don't like to do that, but this is more friendly. So this is just if you don't mind to use one or the other. Okay. Well, let's go. For a practical way of things. So for me, I can be talking for a long time about how to do things, and you can say that you don't like it or you like it, or this is a good idea or not. But at the end, these just points of view. However, the important thing is the result that you get with this way of working, and let me show you what's our results by doing that. So the first thing is when we want to do a benchmarking, and we always like to compare the results that we had with the previous oil and the results that we have now with this kind of oil. So if we're focusing on egg donation program without PGT, for me it's a very good control. Okay, we can see the implantation rate, and we have working with a previous oil, and we had this implantation rate. This is 16.8, so almost 61%. When we move from that oil to the new one, the Kitazato one, what we say is that we had 70% oil. So I know this is not a very good, it's not a randomized control trial, of course, but at least we can say that there is no difference between our results before and after using Kitazato oil, and in fact they are very good condition. And for us, we didn't have a very important change in our way of working. We just work as we used to do. So this is very important for us because we didn't have any change in our setup. So let me show Our current results in different programs. So when we talk about regular cycles and not donor, not PGT cycles, we have now, this is the results from this year. So this is like 3 months of this year, and we have an implantation rate of 52%. If we focus on PGT cycles or over 37 years old, we have a 67% of implantation rate. And if we go to the egg donor cycles without PGT, we have 71% of implantation rate. So what I have to say is, obviously, it is because of other things of cultural conditions, but I can say you that this oil works properly, and we didn't have any problem of moving from the previous one to this one oil. Well, just to conclude my presentation, I would like to say just 3 important things. The first one is that it's easy to work with this type of oil. For us, it didn't have any kind of issue of important changes in the lab, so there is no an impact on your way of working. At least in our lab, we didn't have any changes in our setup. And the last one, and this is very important for me, is that we can achieve the same or even higher rates in terms of clinical outcomes. So I would like to thank all of you for your time, and again for giving me the opportunity to be here and to share experience. So now it's time for questions, and I'll be very happy to answer all of your questions. Thank you very much.
Okay, so I hope you enjoyed the presentations. Just to go over what was discussed in the Q&A following the webinar. So I myself asked a question regarding the stability of the microdrops of media, whether Dr. Bronett found that the use of the heavy oil prevents the drops moving around and merging in the dish as you move around the lab. And certainly this was seen as a benefit, obviously not in terms of the evaporation, but just in terms of handling the dishes. It was certainly beneficial. So then Gisela Maggiotto asked Dr. Bronett whether when they set up the dishes, how that actual procedure is done, because they have so many dishes to set up, and obviously the dish setup is a major factor in preventing the evaporation, especially in microdrops and small volumes when the dishes are being set up. So at IVI Madrid, actually what they do is they have 2 people setting up, one person putting the microdrops in the dishes, and another person straight after the microdrops are made, covering those with oil. So that happens straight after the microdrops are made and prevents any evaporation. We then had a question from the audience. Obviously, Dr. Bronett spoke about in his presentation the volumes of oil that they use in various sized dishes, and the fact that they don't use lids on their dishes. So a question from the audience asked about the volume of oil that they recommend for use in EmbryoScope and EmbryoScope Plus slides. So in this case, Dr. Bronett said that it is certainly always best to stick with the manufacturer's recommendation in terms of the volume of oil to add to those slides, rather than sort of modifying it yourself or adding extra oil volume to those dishes. So I hope you've enjoyed this recording, and please do get in contact with us at Planer if you have any questions regarding anything IVF, or you just want a bit more information. Okay, thanks. Speak to you again soon.